Smith? Smith? Come on in. Have a seat over there. Okay. All right, Mr. Smith. How have you been since our last visit? Have you been going to physical therapy? How often have they got you going to physical therapy? Yeah, it's okay to skip once or twice. Just make sure you're doing the physical therapy exercises at home when you do miss your appointment, okay? So do you feel like the physical therapy's helping? Is the stiffness going away? The swelling going down? Was it just kind of a yellowish clear fluid that was leaking out? That's normal. You had a lot of swelling on this knee here, and when we get a lot of swelling like that, the fluid has to get out somehow, and it just tends to kind of leak around this area here, and it's normal unless it turns green or brown or starts to smell, and that's a whole separate issue, and I would need you to call the office and come in to see me if that happens, okay? Anything else bothering you right now? Yeah, you sound a little hoarse. Yeah, it is that time of year for allergies. Have you been taking your Zyrtec we talked about last time? Does that help at all? Just makes the itchiness in your eyes go away. To make the sneezing stop. Okay. Well, let's take a look at your throat just to be sure everything looks okay. I don't want you having a cold or something to fight off while we're dealing with these knee issues, okay? Just open your mouth and say ah for me. Stick out your tongue, ah. And you've never had your tonsils removed, right? Yeah. I am seeing a lot of redness kind of back in the back there, and things do look a little swollen. I only see a few little white spots, but you could be coming down with strep throat, so I'll make sure we get you a strep test before you leave. I'm just going to feel the lymph nodes under your chin here, see if they're a little bit swollen too. Okay. Yeah, yours are a little swollen. It's that kind of bump right there. Yeah. Okay. Let me write that down. I'll make sure we get the strep test and get you some cephalexin ordered. Have you ever had cephalexin before? Any problems with it? Yeah, it's a broad spectrum, so we give it out for a lot because it kills a lot of different types of bacteria. Okay, well, let's take a look at this knee, and then I want to give the other one, I want to open it up and take a look at the surgical incision and then get it rebandaged, okay? All right, so let's start with this one. Anything new going on? Just that crackling when you move it. Okay. Yeah, that's not uncommon. My concern is that you just don't have a lot of cartilage left, so. Testing the reflexes there. All right, so it looks good. Still looks a little swollen. Have you been using the ice pack I gave you? These are nice because you can they kind of fit to your body shape, and you can heat them or cool them. So you can put them in the freezer, get them cooled down, or you can heat them up in the microwave. Which I would prefer that you put yours in the freezer, but just keep it on this way for 20 minutes at a time, no more than 20 minutes, because that can burn your skin. Too much cold for too long will burn your skin. So leave it on for 20 minutes, and then take it off for 20 minutes, okay? All right, so I'm going to send you home with another one of these, just to be sure. Make sure you're using it, okay? All right. And you were complaining last time of the hip pain, which I think it's got a lot to do with the knee. with this joint being so swollen and overused. So I'm going to send you home with some of this. This is actually a topical cream, and it's kind of new. It's actually made by an alternative pharmacy, and they send it directly to your home. And it has gabapentin in it, which is for nerve pain. It has ketamine in it, which is just a really strong painkiller. It has ibuprofen in it, which is anti-inflammatory. And it also has a little bit of clonidine in it, which just kind of settles things down. But yeah, you can apply it directly to the skin, and those chemicals are in such tiny, tiny amounts that just applying it to your skin with, little drops isn't going to have a big systemic effect. So not going to affect anywhere on your body except the location you put it on. But I will give you a prescription for that. See, it's just a got a little pump in there, and it only comes with a small amount. But it's pretty efficient from what I've been hearing from my other patients. So we'll send that home with you. Okay. I did print up your x-rays. They were sent over by your previous doctor, so I was just going to go over them with you. I do see the hip x-ray, so I'm seeing your pelvic bones here. Let's put these down. Okay. All right. Get these in order here. Okay, so what I'm seeing is your pelvis right here, and that's forming, your pelvis forms kind of a C shape, it's a socket, and then this part here is the femur itself. So this is the head of the femur, and it's sitting in that C-shaped socket there of your pelvis. And I don't see any wearing away of the head of the femur. I don't see any wearing away of the socket part of the hip. So I don't think your hip problems have anything to do with any fractures or dislocations or hip dysplasia or anything like that. Okay? So it's kind of like throbbing in your hip. Does it radiate up to your back and down your leg? Okay, well, if it started doing that, I'd be more concerned it was a sciatic nerve pain. But yours seems to be kind of inflammation of the joint itself, and it's most likely related to the knee. But I did do another x-ray here, and again, I'm seeing the pelvic inlet here, and the bone fits nicely in there, just like it's supposed to. And the bone looks nice and solid. Don't see any lack of calcium in the bones. The bone looks strong, the joint looks strong. So that's really good. And then just to cover everything, I did check out the posterior of the femur. And as you can see, the bone is really solid. It looks great. No hairline fractures, no breaks. And there's the bottom sitting right there in the knee joint. It's got a little wear and tear on the bottom, but we'll talk about that in a minute. So this is the knee joint itself, and this is that knee that's been grinding on you. So again, this is the femur bone, and then this is the bottom of the femur. It's not actually attached to this little bone. The little bone there is the patella. That's what you're calling your kneecap. And this is the tibia bone. So the femur, the kneecap, and the tibia make up this knee joint. And if you look, you should actually see a nice little space between this little bone and the femur itself. And you don't see any space. That kneecap is sitting directly on your femur bone, which means instead of having a nice smooth pad to go across, instead it's raking across that femur. It's just bone on bone. So I did some more x-rays of the leg bones. So here, this is going to be your tibia, and that little part of the tibia is the piece that sticks out at the bottom of your foot that you call your ankle. That's what that is. So the tibia is this large bone of the foot, or well, the lower leg, and this is the top of the tibia. If you notice, it's kind of flat, and that's not what it's supposed to look like. It's supposed to have a piece that comes up, a piece that comes up, and then a valley in the middle between those two paces. And that's where cartilage would go. And as you can see, you don't have much space there because there's just no cartilage. And this is another one of the tibia. So we're tracing the tibia down to the ankle, and I don't see any breaks in the tibia. I don't see any deformities or any reason to be concerned. That's the fibula bone. It's kind of worthless. It's just a joint, a bone and muscle and tendon attachment. And everything down here with your ankle looks excellent. So I'm not concerned with any ankle problems, not concerned with any hip problems. It looks like everything's just centering on that knee, not having any cartilage. So feeling your knee, it feels, I'm not feeling a lot of swelling anymore. And I don't think you need a knee replacement yet. The problem with knee replacements is they don't last forever. So if I did one now, I'd just be doing another one on you in 5 to 10 years. And the less surgery a person has to have in their life, the better. So for now, we do have some options with your knee. Just lift your leg up for me. Okay, lift it again. Okay. All right, now try and keep my hand from pressing your leg down. Okay. All right. And you've got good muscle tone up here in your thigh there. You've got a lot of good muscle tone. So I don't think that the tendons are weak. I really just think it's the lack of cartilage. So the options we have, other than a knee replacement, which I know you want, right now I can give you some cortisone injections. I can't give you those forever. They do take away the pain in the joint for anywhere from a month to 3 or 4 months. It just varies person to person. So we can start there. Insurance covers that. They would much rather cover a cortisone injection than an actual surgery. And then after a few cortisone shots, they're not really going to be helping anymore as that cartilage continues to wear away. So I'm going to try and get you some of it's a new thing that they're doing where it's synovial fluid, which is the fluid that's normally in your joint. But yours isn't making any anymore, so they make a synthetic version of it that can be injected into your knee. And we'll try that after the cortisone. And then once that fails and physical therapy fails, then we could possibly do a partial knee replacement, which is just where I would replace the head of the tibia and then the kneecap itself and create a new root for that kneecap to go over the top of the tibia bone. Nope. It's not a long surgery. It's an outpatient surgery. You wouldn't even have to spend the night in the hospital. You would probably be up and walking the same day. Most people only take a couple of weeks off from work. It's not a major surgery. It's not 6 to 8 weeks off of work. It's really in and out, outpatient surgery. You're up walking that same day, and then you're back to work within a couple of weeks. Yeah, it is pretty fascinating what they can do these days. All right, but I do want to check out this other knee and look at the surgical incision on that one because it is due for a bandage change. Okay. So let's just take a look at that bandage. Okay. All right, just stretch your leg out here for me. Okay. All right, can you wiggle these toes for me? Great. Okay, wiggle the other toes. All right. I'm going to try and push your feet forward with my hand, so I want you to prevent me from doing that. Okay, great. So now I want you to push up on my hand. Good, good. And your pulse feels good in that foot. Seeing good cap refill. All right, everything's looking great. Not seeing a lot of swelling anymore. So let's go ahead and get that old bandage off. It's gonna hurt because you've got hair on your leg. I know. You know, I used to rip it all off at one time. No. Okay. piece over here. And next piece. I know, I'm so sorry. Okay, let's cut that piece. Okay. All right, one more piece off the top here. Piece cut. Right. And then last one. All right, I'm gonna rip the rest of it off, okay? You did great. All right. Okay. All right, well, let's look at this. Okay. It looks like it's healing nicely. The sutures are still intact. The skin's not red or hot. It looks great. Looks like it's gonna heal nicely. Okay, so I'm just gonna redress it now. Just have a little gauze roll, as always. And then one of these. It's just a little ABD pad, which is another word for dry gauze. So it looks like this. It's actually very breathable. And I say breathable because when we cover up wounds, we don't want to cover them up so they don't get any oxygen. The bacteria that smell and cause infections are the ones that breed with no oxygen. So everything I'm going to put on your leg is breathable. Okay, I am going to moisten these with some saline. Go ahead and dump some of that on there. Let's see. Okay. All right. And then I'm just going to lay this one here. And grab another one. And moisten that one with some saline. We like them to be moist because it keeps the wound from all the stuff drying up and getting all crusty and nasty. So we moistened it first and we apply that just like this to the wound itself. And then I'm going to wrap those up with some dry gauze, which is this stuff here. All right, so if you could just lift that leg up for me. Great, great, great. All right, lift it again. Okay. And again. Okay. And again. All right. And then one more time. Okay. Excellent. Okay, so let's tape that up. Just make sure it doesn't come undone. Okay. Put this tape here. All right. And another piece over the top. I'm using the sports tape this time because it's less likely to get wet and come undone. Okay. And then nice big long piece for the side. Okay. And the sports tape, it makes it able for you to move more, even with all these bandages on. And they're waterproof, which makes them a lot better in the summertime. And this will be your last one. Put this along the other side. Okay, there we go. Throw away all this extra stuff. All right. And okay, so remember we talked about the cortisone shot? So first thing I'm going to do is numb the area with some lidocaine because it is a pretty big needle. Don't want you to freak out. Just letting you know in advance, it's not the tiniest needle we have. So, got a little packet with some lidocaine on it. I'm gonna rub this spot on this knee. Good to know. Okay. Alright. Let it dry off. No, I would never stick somebody before this lidocaine's dry. That's just a bad idea. Yeah, you don't like shots of any kind. Most people don't. But this one's just really quick, I promise. Oh, you did. Yeah, you have to get a lot of them as a kid to find out what you're allergic to. Okay, all right. So it is just a tiny plunger, just gonna be a milliliter. So use my little vial here. That's actually more like 5 milliliters. I'm not gonna give you the whole thing. You just need like 1 milliliter of that. So take the lid out of here. Take my lid off. And I'm gonna open another alcohol wipe. Let's scrub the top of that. Let's scrub the top of my syringe here. And then I'm just gonna withdraw 1 milliliter. Okay, put my lid back on. All right. Okay, can you feel that? Can you feel me touching your knee? Good. Okay, here we go. 1, 2, 3. See? Super easy. And let me put that in the sharps container. All right. So the cortisone works pretty fast. You should start feeling the effect of it tonight. And you'll find you'll have a lot more movement in that knee and a lot less pain when you move it, okay? All right. Everything looks good. Looks like you're healing okay after the accident. Don't forget, ice on this knee for 20 minutes and then 20 minutes off. Okay? Let's throw this in the freezer for a little bit to get it nice and wet. And then this stuff is just as you need it. You just open it up. It has a little plunger. 1 little drop will do. And you just rub it in on this part of your knee and down on the sides. And it has all that anti-inflammatory stuff in it and pain reliever. So don't rub it anywhere else, just that part of your knee. And then you put it up and you will be good to go. All right, it was a pleasure seeing you again. Just head on up to the secretary and she'll schedule your next appointment. Thank you.